So hi, I'm Dr. Peter Bernstein. I am the director of the Division of Maternal Fetal Medicine here at Montefiore Medical Center and the Albert Einstein College of Medicine.
Hi, my name is Lisa Nathan. I am the medical director of the Labor and Delivery Unit at Weiler Hospital within the Montefiore Medical System.
We hit our peak with seeing women infected with the SARS-CoV virus back in April. Almost 30% of the women we were seeing on labor and delivery had evidence of the infection.
I think now with our universal testing, it's definitely improved safety across the board for patients, visitors, our staff, because now we know so much more about the illness and the spectrum of disease. It's been quite interesting to learn about all the different ways it can present.
The progression that we went through, first only testing women who presented with symptoms that we thought might be consistent with COVID, to testing every woman who was being admitted for COVID.
Sure, I think it was a natural progression in some ways. In the beginning, we didn't know much. We didn't have a lot of testing supplies at the time. We weren't set up for it, and so we were trying to limit who we were testing. We were trying to follow guidelines and only test people who were symptomatic. But soon started to learn about the spectrum of disease and ways that people can present. And with time, as testing supplies became more abundant and our hospital systems were set up better to be able to do more testing, we realized that there clearly were asymptomatic patients who had this, and the best way to keep them safe, as well as their babies, as well as their visitors, staff at the hospital, was really to start universal testing so that we could try to keep patients safe, keep them within their rooms if they were positive, keep them in the appropriate type of rooms depending on what type of therapy they were on, negative pressure rooms if they were requiring high flow nasal cannula oxygen therapy, for example. So all of these things helped by broadening the amount of testing and the amount of testing, as well as the people who were tested. So testing the visitors as well as the patients upon admission.
What about, we're testing the support people who are accompanying women in labor?
And it's a very sensitive topic. The support people are obviously integral to the patient's well-being, their outcomes. I think we all understand how important those people are during labor and delivery, as well as the postpartum period. People feel very strongly, I think, on both sides of the equation with this issue. I think that what we chose to do was, sort of the best decision for our patients. I think it's very important, that being said, to test visitors when they come for many reasons. Obviously, if they test positive, across the board, anyone who is accompanying a patient, any visitor, we are asking them to stay in the rooms, to not come out into any of the communal areas, not to change visitors, once they are admitted and they are in the room, they're asked to stay in the room for the duration to try to limit any risk to anybody. But especially for those who have tested positive, we do allow them to stay on the labor and delivery unit throughout the labor and birth. And it's important to have tested them and know that they are positive for a number of different reasons, one of which is sometimes there are discordant couples. We also know that testing can be quite poor. So we have a number of couples who have come in who the mother tests negative with the PCR, and someone who they are living with, who is their visitor, tests positive. We have now come to start testing with antibody tests as well upon admission, to really try to improve our detection rate. But in those circumstances, the baby becomes a PUI, the patient herself becomes a PUI, and there is a heightened degree of awareness for the staff. And also it's good for the family to know the results of this as well, so that they can be that more careful with the newborn after the newborn is with them and is back at home. So we do believe that testing for universal testing for the visitors as well is very important.